Hellos, welcome to today's episode. Daktari explains here, keeping it as basic as possible. My name is Cynthia Njogu. I'm a medical doctor by profession. If you haven't subscribed, we are getting serious, we're getting deep into the meat, we're getting into conditions to make your health journey as easy as it can possibly be. So be sure to like, subscribe, hit that notification bell down below because you don't want to miss any of the coming videos. Be sure as well to check the previous ones where we're able to lay a foundation of this platform. Now today we are discussing a terrible condition, sorry to say, because it's one of those conditions that right now I am talking to you and I'm fine, and then the next minute my life is changed. And for that reason, people have called it in the past a curse. People have called it God's wrath. Others look at it from a person has been stricken by lightning and such like things. And what is this condition? Stroke. What we call from our end cerebral vascular accident. So cerebral is the brain, vascular is the blood vessels, and then accident. So it's an accident happening in the blood vessels of the brain. So cerebral vascular accident, CVA, or stroke. Now, inside the brain we have lobes, and each lobes are specific. They have a dominating function among others. So in the frontal lobe, I'll put a picture, we have the executive functions, the learning and all. Then in the parietal lobe, we have the sensory function. Then in the temporal lobe, we have the speech centers and language. And then back here at the occipital region, we have vision. So it's funny because our eyes are just here, so I see, but the interpretation of what I'm seeing is actually being interpreted at my occipital lobe, which is just behind here. Beautiful creation, I tell you. Then inside this brain we have blood vessels which form a circle, so we call it circle of Willis. And from this circle, blood vessels are able to spread out to all these different lobes. So that's just a basic outline of how things are organized inside our brains. So in cerebral vascular accidents, we've said is an accident in the blood, in these blood vessels that are supposed to give blood flow to those areas that we mentioned. So two things could happen to a blood vessel. One, it could be an ischemic process could occur. What does that mean? It means for some reason this blood vessel is not able to send blood to that particular function of the brain. Why was it important for us to give an outline of what the functions of the various areas is? Because if I'll present with vision problems, then most likely what is affected, the blood vessel affected, is the blood vessel that gives blood to my occipital, or this lobe that is behind here. If I present with language difficulty, most likely the blood vessel that has been affected, that is undergoing an accident, is the blood vessel that gives blood to my temporal lobes, the areas where the speech and language are controlled. So that is the reason we need to have an overview of just the functionality. Now, so we say the blood vessel could struggle for some reason to give blood, or the blood vessel could burst and it's not just bleeding. You know, there's a difference between blood flowing and just bleeding. It's not the same, because bleeding is not what we want in a normal process. So ischemic process is 80% of the cases, and then 20% is hemorrhagic. Now, so that means our discussion might tend to incline more to this, which is common. So in ischemia, what happens? So you have a blood vessel. I'll put images. So inside this blood vessel, you have what is called atherosclerosis. This is a plaque. This is something that should not be in the blood vessel now starts to form. And more often than not, if this is my blood vessel, something occludes it like this. So you can see the space that is left is only here for the blood to pass through. Really nice of my illustrations, right? So this which is formed and adds to the blood vessel is usually comprising mostly of cholesterol and calcium deposits sometimes and all that. And they end up narrowing the distance, the diameter of the blood vessel, and blood is not able to push through to that particular area. So that, and now as more and more of that atheroma or atherosclerosis continue to happen, means the narrower and narrower and narrower your blood vessel comes. Now it will reach a particular point where it will completely cut off blood flow to the brain. So that brings me to the risk factors for stroke. It simply means if you have a lot of cholesterol, if you have you've had conditions with cholesterol, there are people who genetically they have dyslipidemias, that is cholesterol control for them has become an issue, or you're obesity, and now you have too much cholesterol. If you have conditions like diabetes, these are conditions that are able to interfere with the lining of the blood vessel, and now they predispose you to getting these atheromas. Hypertension, because hypertension causes because too much pressure is passing through this blood vessel. So the blood vessel has to protect itself, the walls, so the walls get thicker in size. So if the wall was this, if the wall had its own thickness, now it gets thicker and thicker. So as it gets thicker inside, the space gets narrower because the wall is getting thicker. And the reason it does this is to keep up with that much pressure that is going inside as the blood is being pushed. So it gets to a point now this blood vessel just closes, and that is where now there is no more blood flow to that particular aspect of the brain. So we've said it could be conditions like diabetes, hypertension, problem with cholesterol. So these ones will allow for atheromas to form. It could be an embolus. It could be you have a problem with clotting problems, which we'll look at in the course of time. You just end up forming clots. People who get conditions like deep clots in the legs, and sometimes it can form in the lungs, in ideally any blood vessel. Sometimes a clot comes all the way from the heart, and there's a blood vessel, they call them the internal carotids, which go to form blood vessels in the brain. So that clot just gets pushed straight to the brain, and the diameter of the blood vessels coming from the heart is really big, so the clot just passes. But as it gets to the brain vessels, which get narrower and narrower, this clot now goes and closes. So all these things will give you an ischemic stroke. Other end is hemorrhagic, which I just mentioned in passing. These are people who have abnormal malformations of the arteries and veins, and that's why they burst. They have things like aneurysms, which we'll look at, and that's why they burst, but this is not common. Now, I wouldn't put you here all this time just to teach you what the doctor needs should know and help. What is important for the public to know when it comes to stroke is this. There are main features, there are many. Stroke will present based on the particular of the brain that is affected, but there are common features that present, and I want you to remember the word FAST, F-A-S-T, facial droopiness. You'll realize if you've interacted with someone with stroke, or you've had stroke, you've been told, the face becomes asymmetrical, the lips fall, they look like they're falling, the eyes look like they are, so the face is not symmetrical. I'll put a photo of that. So that's droopiness. Then arm weakness. These are people who complain that they are feeling a certain weakness in the arm on one side or the legs on one side, that weakness. Then from there, S is speech disturbances. They were talking to you like I am, and then suddenly you cannot really tell what has just happened. Then so facial droopiness, arm weakness, speech disturbance, and T is time to act. It's time to call 999. That's not in our setting. It's time to call the emergency services that are available to you. Now, one important thing to note for the public is you can help. Stroke is a condition that results in permanent disabilities in some instances, and now from there people are just taught to live with those disabilities, what we now call occupational therapy, physiotherapy, things like that. But stroke gives you up to at least 3 hours, but at least if you can get it within 1 hour, the doctor can be able to give your loved one a medication that is able to go and just break down that clot. and that person recovers almost fully and lives their life like it was just another phase they went through. So it is important for us to awaken to realizing those features, that is the fast that I've given you and the teething time to act, so that if you're able to take your loved one within the first 1 hour or 2, when it goes to, if it extends, at least do it immediately, so that if you go to a facility where they don't have these particular medications, like one we call TPA, tissue plasminogen activator, if they don't have that because it's not available in any resource, then they can put you in an ambulance and quickly refer you to where that can be found. And then now that medication is able to just go and break down that clot and the stroke is resolved. After 3 hours, unfortunately, these medications cannot be used. And what that means is that particular area of the brain now is dead, now cannot be salvaged. Initially, we could salvage. Now we cannot salvage. So if it's speech that is gone, it's gone. So from there, they go through speech therapy, if they still have a little bit of it left, or occupational therapy, how to live with these conditions as they're able to maneuver through their life. So that was the goal of this video. I can see I've spent 10 minutes, but I really wanted the public to know of that fast and to know time it acts. Now, for most people with stroke, most conditions, the take-home medications will be, you probably are on an aspirin. The aim is just to make sure platelets are not clotting, they are not aggregating and increasing the chances of you clotting and all that. You're probably on a medication, a statin or a fibrate. Commonly we have that of a statin with us, and that helps in controlling your cholesterol so that you don't get the same condition again. Then from there will be hypertensive, antihypertensive medication if you're hypertensive or if you've just been started. So that is all for today. Remember, you can save a person with stroke. You can prevent those permanent damages from occurring. That is all for today. Let me know your experience if you've had someone around you get that condition or a loved one, and what happened and currently how they are. Be sure to reach out for any questions as we continue to make this journey as easy as we can possibly make it by impacting you with the necessary information. That's all for today. Have a beautiful time.